For VOA Learning English, this is the Health Report in Special English. Different groups around the world are working to expand the uses for mobile technology in healthcare. Patricia Michel is Executive Director of an organization called the mHealth Alliance. She says mobile home use is far more widespread than it was only a few years ago. She says there are 6 billion mobile phone subscriptions worldwide. She adds the most rapidly growing markets are those in developing countries. Patricia Michel says a lot of work is being done to use mobile technology for mother and child health. She says earlier work had been done to look at mobile technologies that could help control HIV and AIDS. There is a lot of evidence on mobile phones being used for treatment, compliance, and care management. Recently, more than 4,000 people from 50 countries met at the 4th Annual mHealth Summit. The summit brings together experts the organizers call the mHealth ecosystem. This includes non-governmental organizations, governments, and the technology industry. Secretary of State Hillary Clinton launched a public-private partnership called the Mobile Alliance for Maternal Action, or MAMA, in 2011. The MAMA program sends messages to mobile phones to educate women about their health. Millions of pregnant women and babies around the world are at risk of life-threatening illnesses, and millions die needlessly every year. Health messages can also be sent to husbands and mothers-in-law and entire families, so everyone can be informed about health issues. For VOA Learning English, I'm Carolyn Presutti. From VOA Learning English, this is the Health Report in Special English. Nigerian doctor Ucha Amazigo has received the Prince Mahidan Award for outstanding efforts in public health. Dr. Amazigo recently traveled to Thailand to receive the award. She has been a leader in sub-Saharan Africa in the fight against the disease known as river blindness. The disease begins when people are bitten by the black flies that spread the infection. The disease is known as river blindness because the flies live near fast-moving rivers and streams. Tiny worms spread throughout the body. This incites the body's immune system to attempt to fight the invaders. But the body's intense response can destroy the eye nerves. The infection can cause not only blindness, it also causes a painful skin disease. The cause of river blindness was first identified in Guatemala almost 100 years ago. The disease continues to be a serious health problem in many African nations and in Yemen. Medical treatment lasting as long as 20 years is necessary to keep victims free from the parasite that causes the disease. Dr. Amazigo is a former director of the World Health Organization's African Program for psoriasis control. That is the medical name for river blindness. Dr. Amazigo organized local treatment programs in communities. Now, 117,000 communities under 19 African governments treat the disease locally. In 1987, the drug manufacturer Merck launched a program to provide a medicine called ivermectin to everyone affected by the disease. The company said it would provide the treatment for free as long as necessary through the community-directed program. For VOA Learning English, I'm Carolyn Presutti.
From VOA Learning English, this is the Health Report in Special English. New research shows that overweight or even slightly obese people have a lower risk of early death than people considered to be normal weight. Researchers examined the results of 97 studies. Most of the studies were less than 10 years old. They included almost 3 million adults from around the world, including the United States, Canada, China, Taiwan, Brazil, India, and Mexico. The research was carried out at the Centers for Disease Control and Prevention in the United States. The study found that people who were considered overweight or slightly obese were 5 to 6% less likely to die from all causes than people of normal weight. But people with higher obesity ratings had almost a 30% greater risk of death compared to normal weight individuals. Catherine Flegel led the study. She says she was not surprised that there was no higher risk for overweight people, but she had not thought that the risk of death was definitely lower. The study has raised new questions about body mass index, or BMI. This is a measurement of body fat as a ratio of height to weight. BMI guidelines were used for the study. In recent years, many public health experts have promoted body mass index as a way to predict the risk of health problems. But a person's BMI can be misleading. Stephen Heimsfield is head of the Pennington Biomedical Research Center in Louisiana. He says people can be physically fit and in good health, but might weigh more because they are more muscular. Still, he cautions that the study's findings should not be an excuse for people to add a few more pounds. For VOA Learning English, I'm Laurel Bowman.
From VOA Learning English, this is Health. More than 5,000 members of the Pakistani security forces have been killed fighting terrorists and militants since 2001. Twice as many regular and paramilitary troops have been wounded. But the high number of deaths and injuries has resulted in improved care at the Army's top rehabilitation center in Rawalpindi. Doctors at the rehabilitation center help injured troops regain physical and mental skills damaged in war. Aman Ullah lost both of his legs more than a year ago while serving in the Khyber tribal area on the border with Afghanistan. The 23-year-old is one of the thousands of Pakistani soldiers dealing with wounds from Pakistan's fight against militant groups. Most soldiers are wounded by improvised explosive devices, or IEDs. The soldiers are recovering from major medical operations at Rawalpindi's Armed Forces Institute for Rehabilitation Medicine, or AFIRM. Aman Ullah and several other soldiers are now hoping to compete in the next Paralympic Games. This international competition is for athletes with disabilities. The chief of the Rehabilitation Center says he is proud of the progress made in treating the patients. The experience of treating thousands of patients over the years has led to improved medical practices. These improvements include more useful artificial limbs to replace arms and legs lost to injuries. Medical workers have also developed other improved practices for helping wounded soldiers. There are plans to expand the Rawalpindi Rehabilitation Center. For VOA Learning English, I'm Carolyn Prasuti.